I'm Rupayan Kundu. I'm one of the internal medicine residents at the Cleveland Clinic Foundation, Ohio. So yeah, I can talk about this presentation. So basically what we are looking for is, so in clinical trial enrollment success rates are not that well developed. And sometimes we can see 20% clinical trials fail due to due to defective enrollment success. And we defined enrollment success as if the targeted population was versus 80, if that clinical trial can achieve 85% or greater patient population, what was the targeted patient population at that time. So that's what our focus was. What are the factors that determine enrollment success in clinical trials? And what we found that probably there are certain factors, for example, type of studies. There are multiple phases of studies, phase 1, 2, 3. So we found that phase 3 trials have more enrollment than phase 1 and 2. That is kind of well known. Other than that, the industry sponsored studies are basically their success rates are more than the NIH or any government agencies because of their kind of probably more of funding opportunities, more cutting edge technologies from that standpoint. From other things that I want to mention is if the study has more sites, for example, they are multi-centric studies, or probably if they have multi-country studies, for example, 3 or more or 5 or more countries, those studies have more enrollment success rate than those studies who have one country or single center studies. The other thing is there are some kind of patient population. If the study has less than 50 patient population accrual rate versus the other, for example, greater than 200 or 50 to 200. So those less than 50 population studies are better in enrollment success rates than those of greater than 50 or greater than 200 studies. And also those studies who have more primary and secondary endpoints, those usually does better because we have more data point to share with and we have more data point to look into it. So I think I would say that if the study is phase 3 industry sponsored, some multi-centric studies, there are more chances that the study's enrollment success rate will be successful. So basically, there are phases of clinical trials, and I think whenever a patient gets enrolled, we have a long list of things that we usually go through with the patient. For example, what are the risk factors? What are the things that will benefit the patient in the long term, so that they can assess by themselves if they're gonna enroll into those studies or not. So this is kind of more of an informed study. So I think sometimes if you are not enrolled in a study, then you can talk to the program coordinator about more information and what are your fears. Sometimes we can see the patients, they want 3 or 4 things. One is I want to get better. First of all, I want to cure the disease. I want to fight the disease. Second is I want a better lifestyle. I don't want to fight the disease. Whatever time I have left, I want a better lifestyle. So I think whatever the patient's goal is, ultimately, that will determine then the patients can definitely talk to the coordinators to know more about those, and they can basically try to fit those information to their own goal and try to find out if these trials are okay for them or not. And this is always an informed decision.